6 ways to get your home sleep testing devices back on time. Home sleep testing, also known by the abbreviation HST, can benefit patients and healthcare practices alike. When all goes smoothly, advantages include less time to diagnosis, increased patient volumes, and convenience. But patients returning HST devices late, or not returning them at all, is a problem sleep disorder centers and other administrators of HST routinely encounter. I'm Sri Roy, and you're listening to Sleep Review, the trade media outlet for the sleep medicine subspecialty. This podcast is inspired by the growing awareness of the importance of sleep to overall health. We invite all healthcare professionals, from primary care physicians to sleep specialists to dentists and others, to tune in and learn about clinically based best practices that will help your patients sleep better. Sleep Review does not endorse any products or services, including those that advertise with us. We strive to report clinical information that you can apply to your practice today. This episode is brought to you by the Medcore platform. Learn more at medcore.com/our platform and stay tuned for more information during the break. From signed agreements to return mailers and patient education, this episode provides 6 real-world suggestions for how to get your HST devices back on time. You can get the print article this podcast is based on at www.sleepreviewmag.com and search for the headline, How to Get Your Home Sleep Testing Devices Back on Time. The direct URL is www.sleepreviewmag.com/get-home-sleep-testing-devices-back-time with a hyphen between each word. Suggestion number 1, provide patient education and set expectations. Proper patient education and outreach may be the most important means of ensuring HST device return. SleepMed, a manufacturer and provider of HST, is an outsourcing partner for sleep medicine practices to manage the issuing and returns of devices. At SleepMed, we find that the more patient outreach and engagement we have, the better our outcomes in retrieving the device in a timely manner and getting patients the care they need, says Sean Heiniger, CEO and president of SleepMed. According to Marcia Fulton, RPSGT, Director of Operations at Atlas Sleep Diagnostics, a consent form, as well as precise communication with the patients about return expectations are key. The consent form should outline device education as well as include specific return details, including the date of issue, the date and time the device needs to be returned, and the cost that would be billed to the patient, if any, if the device is not returned. Fulton says the sleep tech issuing the device should be firm when the device is given and openly communicate the time and date the equipment should be returned, in addition to the policy for devices that are not given back. Lee A. Sirkin, MD, board-certified sleep physician and president of Carolina Sleep, has found a method that works. Sirkin, or a member of his medical staff, outlines what the HST is for and what the functions are, outlines the medical applications and what they hope to gain from testing. He does this to engage the patient and create a partnership. Finally, he has the patient sign an agreement regarding the issued device. Sirkin says the agreement should note that the patient is solely responsible for the care and use of the monitor while it is in their possession, as well as note the time, date, and the designated practice for return. This agreement should include an addendum that the patient agrees to be responsible for the replacement costs of the monitor and note the specific cost. Once I carefully engaged with the patient in conversation, instilled a partnership related with them, clearly outlined when and where the monitor was to be returned, and had them sign an agreement that would enforce a fee to the patient to replace the monitor, I had no additional problems with getting the monitors back, Sirkin says. Also, clear communication with the patient about why prompt device return can be beneficial can be key. SleepMed CEO adds, When a patient understands that a quicker diagnosis and immediate treatment will change their health and ultimately life, compliance and timeliness are much easier. There must be a commitment from our team and the patient to be successful. It's a symbiotic process and relationship. Suggestion number 2, do reminder calls and messages. Reminder calls, emails, and text messages can be economical ways to follow up with patients and remind them of the return date. Advanced Sleep Medicine Services, which has numerous sleep clinics, uses automated reminder calls, text messages, and email confirmations. SleepMed uses interactive voice response, also known as IVR, short message service or text, that is SMS, secure email, and outbound care managers. Suggestion number 3, purchase backup testing devices. A significant problem created by non-return or late return is not having enough HSTs for other patients. For this reason, Fulton recommends sleep centers have an emergency backup. If you don't plan for a disaster, then you're more likely to have one, Fulton says. But due to the cost of keeping an extra HST on hand, a backup device may not be a viable solution. If a sleep medicine practice has only one HST, Sirkin says it may not have enough patient volume to justify more than one, or it may lack the financial means for additional equipment. The choice to keep additional inventory on hand will be based on a practice's needs and financial resources, but having a backup device may be a sensible option to minimize financial loss. Insourcing or outsourcing HST device returns requires a system and partnerships to make it cost-effective and clinically effective. Lost inventory will be part of what happens when deploying HST into your facility or practice, so manage your return expectations and plan appropriately to minimize your financial risk, Haniger says. Next, we'll share 3 more ways to get your home sleep testing devices back on time. But first, a thank you to our sponsor, the MedCore platform. MedCore's mantra is not only to innovate within our company, but to provide a data platform for sleep medicine stakeholders to drive innovation within their own businesses. Gain access to hundreds of core data sources, including medical journals, blogs, social media conversations, advertising, emails, and articles. Start leveraging device market insights across your enterprise to make informed decisions at every level today. Sign up for a free demo at medcore.com/our platform and fill out the form at the bottom to schedule a MedCore demo today. That's medcore.com/our-platform. Okay, here's our next suggestion for getting HST devices back on time. Suggestion number 4, allow for after-hours returns. Extended office hours and drop boxes for after-hour returns can facilitate patients returning the devices on time, similar to a book return box located outside of a library. Keeping the returns process as simple as possible is important. Extended daytime and evening availability for returns, as well as drop boxes in some locations, have worked out well for us, says Newman of Advanced Sleep Medicine Services. Suggestion number 5. Provide prepaid mailers or pickup services. The use of shipping companies that provide a pickup service as well as prepaid labels or packages can offer convenience for patients. SleepMed provides patients with return prepaid USPS and FedEx options. Prepaid postage mailers can be of particular benefit to patients who don't live close to the practice. The staff at Carolina Sleep also adds tracking to the packages or requests delivery confirmation. We have had multiple situations whereby we provided a stamped container or box for the patient to return the monitor by mail, Sirkin explains. If we are providing a postage-paid container to return it in, we would then have my staff contact the patient the next day or the day that we expect the device to be placed in the container and then returned or placed in the postal service. We call the patient to remind them and get confirmation that they've done that. Suggestion number 6, implement late fees. The assessment of late fees is an additional option to consider. In a traditional sleep center where the patient's intention was to be seen for a sleep problem, Asking for a credit card to be held on file in the event a late fee is charged may be well received. But if the HST program is run out of a non-traditional sleep center and the patient may not have originally sought out an HST, asking to keep a credit card on file for the device may impact whether the patient takes it home at all. Advanced Sleep Medicine Services had a policy of late fees in the past, but it did not work well, largely because it was a managed care environment with limitations on fees that could be assessed. Newman says, "Now we emphasize a personal approach and ask the patient to make a commitment to us to return the device on time. We tell them that we are counting on them. This policy has worked well." If the sleep center opts to include a late fee in a customer agreement, sourcing HST to a third-party manager may be a good choice. So, in conclusion, there are a number of options to ensure timely return of an HST device, but simplicity may be the best policy. Offering a choice or two is often all you need. The biggest takeaway is to provide patient education and set expectations, instill a sense of urgency in the patient. Most patients do not want to infringe on another patient's sleep study by hogging a device. Engage the patient as a partner in the process and appeal to their goodwill. If they don't return the device when instructed, another patient's test might be postponed or even canceled. And that kind of guilt might lead to other sleep problems, which nobody wants. You've been listening to Sleep Review. I'm Sri Roy, editor. Visit www.sleepreviewmag.com, get home sleep testing devices back time with hyphens between each word to read a print version of this article and to access any cited studies. Remember to visit sponsor www.medcore.com/our platform for a free demo. And tune in again next week for more clinically based best practices that will help your patients sleep better.